Greetings, Kalaga! My name is Leia, your future nurse. For today, I will demonstrate the abdominal assessment. I will just briefly discuss this area for more understanding. Abdominal is the body space between the thorax and pelvis. The primary functions of the abdomen consist of digestion, breathing, absorption of nutrients, posture and balance, as well as the movement. The abdomen contains of all the digestive organs, including the stomach, small and large intestines, pancreas, liver, and gallbladder. The equipments in conducting this assessment are the following: examining light, tape measure, water-soluble skin marking pen, and the stethoscope. Now, let's do the procedure. Prior to the assessment, first we need to identify the client to give the right care and management to them. Introduce yourself to the patient and explain clearly the procedure for them to understand and encourages compliances throughout the assessment. Provide privacy by drawing the curtains and closing the door to allay fear and anxiety. Please do not forget to wash properly your hands for infection control or reduce the spread of microorganisms. You can also use gloves to protect the patient and at the same time protect yourself. Aside from that, ask the patient to void first to have a continuous procedure and to be not distracted while performing the assessment. Then, obtain the patient's health history. Good morning, sir. How are you?
I'm good, thank you.
May I know your name and your birthday?
My name is Matthew. Yeah, Compal, sir. And my birthday is August 28, 2013.
Okay, my name is Leia, your nurse for today. I would like to ask your permission because I'm going to do an assessment to your abdomen to check if there are any abnormalities in the area. But before that, I will just ask a couple of questions regarding to the assessment. Is that okay with you, sir?
Yes, it's okay.
Have you experienced of incidents in abdominal pain?
No.
Do you come across a sudden change in appetite and usual change of weight?
Yes.
Are there any foods that you have difficulty in tolerating and swallowing?
No.
Any experience in digestion, feel bloated after eating?
Yes, when I suddenly eat a lot of food.
What is your usual bowel habits, frequency, and its usual color?
2 to thrice a week, and the color is brown.
Do you have any previous problem in the abdominal area or treatment?
None.
Okay, let's begin to the assessment. First, instruct the client on what are you going to do, why is it necessary, and how the patient can cooperate. Then, assist the client in a supine position with the arms placed comfortably at the side. Proceed in the inspection of the abdomen. Inspect the abdomen for skin integrity, for contour and symmetry, and observe the movements associated with the respiration, peristalsis, or aortic pulsations, and observe the vascular pattern. Sir, I'm going to assess your abdominal area to check if there's any abnormalities. During the assessment, I might ask you to do some things like breathing normally or do a deep breathing and so on that accords to the procedure. If the procedure causes you uncomfortable feeling or you feel fatigued, tell me so I can stop anytime.
Okay, understood.
Can you please remove your shirt for better inspection of your abdominal part?
Okay.
Okay, sir, now please do a supine position. Sir, the surface of your abdomen is normally smooth and have a fair complexion. Your umbilicus is in the midline, inverted, and no discoloration. The shape of the plank is flat, straight, and empty. Negative for scar, stoma, and skin lesions. The abdomen's contour is scapoid from sepoid to symphysis pubis. There's no presence of bulging masses or asymmetry, and negative for visible abdominal veins, peristalsis, and the respiration is normal. All through, there's no presence of abnormalities upon inspection. Remember, having Cushing syndrome, it is an abnormality. It is often purplish red or bluish discoloration because of often increase of hemoglobin in the condition. While the Collins sign, it is discoloration in the umbilicus or in the region of the loins. It is due to the pancreatitis, cancer of the pancreas, ectopic pregnancy, liver problems, thyroid cancer, and other sources of internal bleeding in the abdomen. While the abdomen's contour is depending on the nutritional status of the patient, it may be lightly protuberant or scapoid. Aside from that, patients who have both massive ascite and obesity have visible abdominal distension and gastric or intestinal pattern. Peristalsis is also visible in the patient if positive in the pyloric or intestinal obstruction. Let's move forward in the auscultation of the abdomen. Auscultate the abdomen's bowel sounds, vascular sounds, and peritoneal friction rubs. Okay, sir, I'm going to auscultate your abdomen. First in your right lower quadrant, then to your right upper quadrant, left upper quadrant, and the next is the left lower quadrant. Then after that, I'm going to auscultate your vascular sound. Sir, in the auscultation of the quadrants, it is normoactive for bowel sounds, and to your vascular sound, negative for bruit sound and peritoneal friction rubs. All in all, there's no presence of abnormalities upon auscultation. Take note that auscultation is performed before percussion and palpation. The abnormalities you can hear in the auscultation of the abdomen is the hyperactive sound. It is a loud, high-pitched sound, while the hypoactive sound, it is a reduction in tone, frequency, and the loudness of the vowel sounds. Listen to all 4 quadrants, and you should hear 5 to 30 sounds per minute. And if you don't hear any vowel sounds, you need to listen 5 full minutes. Now to the procedure of the percussion of the abdomen. Percuss several areas in each 4 quadrants to determine the presence of tympany and dullness. Use a systematic pattern. Begin with the lower left quadrant, then lower right quadrant, the upper right quadrant, and to the left upper quadrant. Then, percuss the liver to determine its size. Okay, sir, I'm going to proceed in the percussion of your abdominal area. First in your lower left quadrant, then to your lower right quadrant, upper right quadrant, and then to your upper left quadrant. After that, I am going to percuss your liver to determine its size. Okay, sir. sir, during the percussion, I hear the resonance, timpani, and dullness sounds upon percussion. And the size of your liver is 6 centimeter upon percussion. Overall, there's no abnormalities upon percussion in the abdomen. The percussion of the abdomen used in direct percussion. You will hear normal sound. It is the resonance. It is heard over the lung tissue. Then the tympani. It is heard over the most portions of the abdominal cavity. Then the dullness. It is heard over the solid organs like liver and muscles. It is a short, high pitch, and it is not loud. When flatness sound is heard, there is a presence of extensive pleural effusion over the solid organs such as liver and the heart. Let's proceed to the palpation of the abdomen. Perform light palpation first to detect areas of tenderness and muscle guarding. Systematically explore all 4 quadrants. Then perform deep palpation over all 4 quadrants and palpate the liver to determine its enlargement and tenderness. Now I'm going to palpate your abdomen. Tell me if you feel any pain, tenderness, or rigidity. Okay? I'm going to palpate here.
No.
Here.
No. 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 No.
Okay, now sir. Next is I'm going to do a deep palpation.
No. No. No.
Sir, negative in any pain, masses, nodules, or bumps. There's no presence of enlargement of organs, and overall, there's no abnormalities upon palpation. Bear in mind that if pain is present in any areas, there might be an obstruction or inflammation inside the abdomen. If the abdominal aorta is expansive, it could suggest an aneurysm. Note that the aortic pulsation can be felt in thin patients. Document all the findings and evaluate the other needs of the client. Clean the equipments used and wash properly your hands for infection control. If you use gloves, discard it and place it to the correct receptacle. I hope I clearly demonstrated the assessment of the abdominal area. Once again, Kaalaga, your future nurse, Love, Leia. See you and thanks for watching. Bye!